Hey everyone, Dr. Charlie Johnson. This video is for you if you absolutely hate sitting. If you know you're asked to go on a long car ride, or you know you have to sit at work all day, you are automatically, before you even do it, just thinking to yourself, wow, this is going to be terrible, okay? So if you hate sitting, here's likely what's going on, all right? So here I have a picture of the spine. We know that the spine, there's bones stacked on top of each other. In between each of them is a disc, okay? It kind of has like this jelly-like material. Most of it's water, but it can kind of move back and forth, all right? The most common issue is between the fourth and the fifth L or lumbar, okay, or bones in the back, and you have the disc in between as the spacer, right? So usually what happens is when we sit, right, we tend to slouch. Maybe you also hate sitting on the couch, okay? Maybe that's even worse than a good supportive seat. Usually what happens is as we kind of put pressure on the front, by bending our spine forward, the material in the disc has nowhere else to go, right? Because we kind of clamp down on one side and it pushes towards the back. The issue with this is that there is the spinal cord and the nerves in the back, okay? So not only does pressure increase on the back of the disc, okay, and we know that the outer third, okay, of this ring is controlled by nerves, therefore it allows you to feel pain, but also you can put pressure right on that nerve, which causes sciatica, okay? So herniated disc is the #1 cause of sciatica. The way to fix it, okay, just a quick tip, is you have to stop doing this. So don't do that, right? No, seriously. What you have to do is you have to sit up tall, right? So you stop this pressure distribution on the disc. So you want to keep kind of equal pressure throughout the disc. You may have already noticed that when you're sitting, if your back is supported or you're on a more supportive chair, or you sit up tall, that your back and or leg pain is better, okay? Great news, you figured it out. Now you just have to consistently reinforce that throughout the day, okay? In another video, I'll talk about how you can make a back support. Maybe I'll link to that as I create it. But yeah, so this is the issue. Put pressure on the front of the disc. The disc material moves towards the back, puts pressure on pain-sensitive areas on the back of the disc and potentially your nerves, okay? So if you have any questions about that, email charliejohnsondpt@gmail.com. Thanks.